So I'm getting this question. I'm Dr. Larry Burchett, as an ER doctor on the front line with this corona thing. I'm young and healthy. I don't have any medical conditions. Should I be worried about coronavirus? I don't think so. I think for yourself, I think we are learning more and more about this disease. There was initial fear that, seeing a young Chinese doctor in his 30s die from this on the front line, that hearing these things of the death rates 2%, 3.4%, all these things, worrying that, gosh, am I at risk? Am I going to get this? Do I have a 2 or 3 or 4% chance of dying? And for young, healthy people, really, I don't think that that's the case right now. Death rate is much, much lower because the denominator of that statistic of people dying is much greater because these people aren't coming in. They don't get very sick. 80% of people really don't have very many symptoms, or they're mild. This is not a disease that affects children. So under 15, there are just very few cases. All the case reports that I've seen, I'm not even sure. There may have been, but it's very, very low with pediatrics. So they did one of the initial thing I'm referring to is one of the initial case studies of over 400 people, and there wasn't a single case of a child under 15 that was infected. So especially, this is not a pediatric disease. Should be worried about, if your kids. But then for those that are healthy, don't have medical conditions, and are young, I just don't think this is even going to be. This one was crappy. Let me do this one over.
Stop blocking the light over here. You're putting your hand in front of the light.
I need lighting where I can use my hands. It's not possible.
I get that.
It's
but
not possible.
This is how the
I get it. We'll do it today, but we'll just.
We'll do it in a bigger space.
We'll just have to deal with it because I can't do the arms.
Just do your thing. You're fine.
I'm getting this question a lot. I'm young and healthy. Should I be worried about the coronavirus? Getting that, and if I get it, should I get sick? I'm Dr. Larry Burchett. I'm an ER doctor on the front line with this thing, and I'm getting that question. Should young, healthy people be sick with this? I don't think so. I think it's probably similar to a flu. I don't think it's as deadly for young and healthy. Most of the people that are dying are older, 70s, 80s. It's true. If you're in your 80s and you get it, the mortality is 14%. And if you have other medical conditions like lung disease, heart disease, COPD, that number rises. So it does get scarier for those who are sicker and older. But for young, healthy people, the death rate, you may see case reports of young, healthy people dying. We have young, healthy people that die of the flu. I saw one in the hospital who was 20-something and just obese, who didn't have other medical conditions, that was on a ventilator from influenza a month ago. This happens. Those are case reports. But when we look at these numbers, let me tell you a couple things. One of these initial case report studies on over 420-something patients, not a single case of pediatric illness under 15. So this coronavirus is not a pediatric disease. Adults get it more, but between really then and 50, 60, the incidence of people getting it and having severe disease is much, much lower. I really don't think we have much to worry about. A couple different ways to answer that question. Is it a potential that you could get it? Depends on where you live. If you're in Wuhan, China, yeah, that would be worried that you would get it and you would go through that illness. Probably would be fine. It's not super widespread in the US at this point. So it's most likely that you're not even going to get it. If you do get it, it will probably be mild like a cold, not even as bad as the flu. So I think for a young, healthy person, based on the stuff that we know now, I really don't think you have much to worry about. I think what you should worry about more is getting other people sick, like your grandma. I'm going to talk about that in a second.